So I just want to say good morning to everyone, and I want to thank the ABTA for inviting me here to talk about a really important topic, which is caregivers. I have no disclosures. So I think we'd all agree that we've had sort of a great day yesterday and a good morning talking about tumors and treatments, and we have heard from caregivers, which has been wonderful along the way. My goal now is to shift the focus, to spend the next hour just focusing on supporting the caregivers of people with brain tumors. And so what I want to do today is talk a little bit about the role and the different resources that are out there to support caregivers in their role, and some strategies to help you maintain your well-being along the way. So before we get started, though, I was just wondering if I could see how many people in this room are actually supporting or caring for someone with a brain tumor. Okay. Do we have any people with brain tumors in the room today? Hi, welcome. And how about any health providers? Great. Okay, terrific. Okay. So in San Francisco, we start our caregiver support group every month with the same exercise. And we do this for a couple of reasons. One is just to allow our caregivers a minute just to slow down, arrive at the group, and relax. And two, this is an exercise that anyone can use anytime they're feeling anxious or nervous or a little bit upregulated. So I like to teach it. I like to encourage people to practice it, and then you can access it anytime that you need it, okay? And one of the other things I like about it is that we know this exercise, if only done for even a minute, can actually turn down your nervous system, the one that's responding to stress, and actually turn on your nervous system that helps you relax. So there's some science behind it. So I thought maybe we could just start by trying it. I could teach you this. So if you're comfortable, I'd like to invite you just to sit in your chair, sit up straight. If you can put both of your feet on the ground. And I'm going to invite you to go ahead and close your eyes, if that's okay, or gaze softly at the ground. And I want you just to take a minute to feel the support of that chair. Okay? Feel the support of the chair on your back. Feel the support of the chair on the back of your legs and your bottom. Feel the support of the ground under your feet. Now I'm going to invite you to take a few deep breaths. And you can do this any way that you want, or you can try this exercise. Through your nose for a count of about 3 to 4. And then exhale through your mouth for a count of about 6 to 8. So we're going to do this just for about a minute or so. Okay. I'll ask you to open your eyes. Didn't that feel good? I needed that up here too. I just want you to know. Help me settle down. So when somebody has a brain tumor Everyone that loves them is impacted. And I want to acknowledge that the ABTA and many of those on your medical team know that too, and we see you. So a brain tumor does not occur in isolation. Each person with a brain tumor is usually part of a family system. So they're often part of a couple. Almost everyone comes from some sort of a family and belongs to at least one community, okay? And as a result of the diagnosis, the person that you're living with, a lot of times, it could be your life partner, might not be the same. There may be changes, whether it's physical changes, cognitive changes, personality changes, or even emotional changes. So let's go back to this statement. When someone has a brain tumor, everyone who loves them is impacted too. And I want to invite you just to take a minute and let yourselves think about this, okay? It's important to acknowledge the changes that you're experiencing. So one of the other things I'm hoping today is that we can be a little bit interactive. And so I am going to invite people now just to go through a short introductory exercise. Maybe you could pair up with someone who's next to you, preferably someone you don't know. If you could tell them who you are, what your role is, if you're a patient, caregiver, or provider, okay? And how long you've been at it. And then if you're comfortable, it would be nice for you to share with the other person how this tumor has impacted you, okay? Not your family member, not your neighbor, but how has it impacted you? And I'm going to give you each a minute, and then I'm going to say switch, so you each have 60 seconds to talk. So if you pair up, and then we'll start. How's that sound? You need a partner. Okay, I'm going to ask you to switch now. Sorry, can you stop and switch? Okay, everybody, sorry. It looks like there's good conversation going out there. I'm going to ask if you guys can just take a pause here. And maybe there's someone out there, I have someone out here with a microphone. Maybe there's one or two of you that would like to share with the group how this experience of having a brain tumor has impacted you. Is there anybody out there that wants to be brave and share with the group?
Hi, everybody. So I work for the ABTA, but my husband is a 13-year anaplastic astrocytoma survivor, and he's doing really well. But I think it's so important. I'm so glad we have this session because caregivers, as my husband has said, is, about me is that, take care of my wife first. She needs help more than I do when he was going through, hell, chemo, radiation, etc. So we're in a good place, but it's still part of our lives. And I'm so glad that you're all here, and look forward to hear what you how this has impacted you.
Okay, anybody else?
Hi, my name is Kim. I'm a volunteer for ABTA. I was a caregiver with my mom when my dad had a GBM about 20 years ago. It was a quick sickness, but I lived an hour and 45 minutes away from my mother. I had a 2-year-old at the time. It impacted me deeply, and it really changed who I was as a person and the way that I look at life. I would go through it again in a heartbeat. My dad was my best friend. And if something like this doesn't change you, it will. And you become a very different person and have a very different outlook on life.
Thank you. Thanks for sharing. That actually leads nicely into my next slide. Good job. So after the diagnosis of a brain tumor, old ways of doing things and living may need to give way to new. And that may include you taking on the role of being a caregiver or a care partner. And I'm guessing, for those of that are here in the room, that's already happened. That's why you're here. So what does it mean to be a caregiver? By definition, a caregiver, and some people are using more frequently this word care partner, is anyone who provides some degree of assistance to a chronically ill or disabled person on a regular basis. And that can take the form of emotional support. You can actually become an extension of the medical team, monitoring symptoms, administering medications. You can take over all the roles in the house and or advocate for the patient. Now, I wanted just to talk, we hear the word care partner, we hear the word caregiver. A new term that I've heard recently was care guide, which was actually the father of a young adult. What I like everyone to think about is, I'm not sure that there's much difference. All of these people are providing assistance to someone with a brain tumor. It just varies on level of degree. I think on the far left is the guider, who might be more navigation. In the middle is this word that's gotten a lot of buzz lately, this care partner. When we think about partnership, we think about an equal relationship. It usually means giving and taking, and people are able to take care of each other. What I like about the partnership piece is that partners, not only do they take care of their loved one, but they also have some responsibility to take care of themselves as part of that partnership. And they're able to keep their own interest as well as the others in perspective. So that's kind of something that might be worth just thinking about and hanging on to. Now, we know with a brain tumor, because of the types of symptoms that people have, physical and cognitive, an equal partnership isn't always easy to maintain, sometimes or all of the time. And so caregiving tends to historically be a little bit more one-sided. There's some giving and some receiving, okay? And so that's part of, I guess historically also what's happened with caregivers is that they tend to put their own needs aside. So caregivers would do all this giving and give up their own health, their own needs. And in the end, we know this really isn't sustainable for a long time, right? And that's part of why we're having this session today. So I invite people to sort of see themselves anywhere along this continuum and take the pieces that are useful to them as they go forward. And I sort of like that part of keeping your own interest in perspective and needing to take care of yourself. You've all heard about that, self-care. So why is it that caring for someone with a brain tumor is so challenging? What makes it different? And the truth is, it's a neurologic illness, and it has the potential to really change the essence of the person who's getting care. And I think what also makes it hard is that for many people, the person with the illness, sometimes those symptoms are invisible to the outside world. And so people can look at your loved one, look at the person, and think everything's going along fine, and not really understand what life is like at home. And so there can be a tremendous amount of isolation. I think that's one of the things that I hear about most in my work. We heard a little bit about this just in the last session, is that caregivers and patients have similar needs around the diagnosis and different. So similar, patients and caregivers need information about the tumor, what kind of treatments they need help navigating, and then they have different needs, right? Everybody arrives at the diagnosis sort of in a different place, and some can be high, and some can be low, and it happens at different times. What happens is that often the needs of the person with the tumor are addressed, but not always the needs of that caregiver, those different needs. Okay, and so caregivers are often left to figure things out on themselves. They have to reinvent the wheel. They have to figure things out on the fly. So I would like to invite any providers that are in this room or watching later that comprehensive care of someone with a brain tumor should include addressing the needs of both the person with the tumor and the caregiver. That should be part of the package. So for many of you, when a diagnosis of a brain tumor happens, it's often dramatic, it's chaotic. Things for a lot of people happen overnight, and suddenly you're thrust into this role that you have no formal training for, okay? And you've assumed that role on top of everything else that you already had going on in your life. For almost everyone at the beginning, it feels overwhelming and chaotic. Would everybody agree with that? Remember that beginning? And yet, for most people, things do settle down. This isn't static, and there will be periods where you'll feel like you've got your feet under the ground again and you go along. What I think is interesting is that becoming a caregiver often happens without much discussion, right? People don't ask you about this. You just sort of take on the role. And so you say to yourself, where do you begin? And you kind of have to start by just focusing on the moment, looking at the day, and do what you can in that moment. Ideally, you'll find a team. You'll gather a team. Maybe it's your family member. Some of you have talked about great friends. And what you want to do is think about what needs to be done and who can help, okay? Sometimes caregivers find that they have to take on the role of being a medical researcher. They have to take on the house management role. Maybe they're being a nurse assistant, and some people have to take on running all the finances, and that feels like a lot. So anything you can delegate is always a good thing, okay? And it might be things that you really like, but you might have to shuffle things around. So be open to that. One of the things that this also includes is uncovering the resources for caregivers. Sometimes you're so busy you can't even think. So this, I always feel like, is a good job to delegate, is finding what's out there in your community for caregivers. Somebody wants to help, you could put them on this job to run down the resources for caregivers. So I have up here three of my favorite resources for new caregivers, and they can also be useful for old caregivers or experienced caregivers. I want you to know that becoming a caregiver is not necessarily an intuitive role. It takes practice, and I want you to all know that it can be done. It takes some time and persistence and some trial and error. So up here I have the UCSF Orientation to Caregiving. I have the ABTA Caregiver Handbook, and I have a website from another great national organization called the Family Caregiver Alliance. And all three of these actually explain what it means to be a caregiver. It helps people think very early on about all the things that go into taking on the role. It helps you prioritize. And they also have lots of information that some people don't even think about, like how to talk with your kids, how to do insurance, disability, things like that. I think what's also nice about these resources is that they continue to serve as a resource for people as things go along. I think a lot of times caregivers feel like they finally get things figured out, and then guess what? Something changes, and you feel like you're starting over again. So you can always refer back to these. Now, beyond information about the role, caregivers need and want a few things, and I highlight these just because I think it's nice to know that some of the feelings that you're having are normal. This is what the literature says when we study caregivers. Caregivers want acknowledgement. They want people to know this is impacting them, and they want information on how to support the patient, provide the care, and navigate the illness. Most caregivers need emotional support as well. Many of you are dealing with all kinds of emotions, and there's so much isolation. I think sometimes when something like this happens, we often turn inward. The other complicated thing with a brain tumor is a lot of times the person that you would have relied on for help and to navigate through these things is your patient, is the person with the tumor, and so they're not available. As we heard earlier this morning, there is worry. There's worry about the future. There's loss of health of your loved one. There can be grief over the loss. And so as a result, people are experiencing a lot of sadness, anxiety, overwhelm, and high levels of distress. It's well documented. The other thing we know is that although there's a lot of similarities for caregivers, each person is different. Each person shows up to the illness with different resources, whether that's financial, educational, cultural. And so that makes the way that you'll handle the situation a little bit different, as well as the situation of your patient and the symptoms that the person with the tumor is experiencing. So the types of resources that we offer, there's some general, but people need a tailored, individualized, tailored intervention usually. Each person is specific. Ideally, you'd have someone in your healthcare team asking you what you need, but that doesn't always happen. So it may be up to you to give yourself some time to think about what you need so that you can ask for it. Because if you don't ask for it, you might not get it. So let's talk about the emotional support that caregivers need. We've heard the word roller coaster a couple times in this meeting, and many people describe this as how they feel. And there's quite a bit of data that shows that all the things that caregivers experience really do put them at high risk for distress, mood disturbance, sleep disorder, and just kind of an overall decreased quality of life. If someone is prone to depression or becomes clinically depressed as a result of this situation, which can happen, it pretty much makes it impossible for them to do their job as a caregiver. So I think maybe the most important thing a caregiver can do is just keep a pulse on their emotional well-being. So heads up alert, this is something you need to pay attention to. So along with paying attention to your emotional health, it is important to be aware of the common pitfalls that caregivers fall into, okay? So a lot of people like to go head down and proceed as if nothing's changed. Some people don't like to allow any time or room for feelings, and they try to do everything. I think that's common. It's hard for us to accept help. Just as human beings, it's hard. And as a result, we distance ourselves from people that can help. So I'm just wondering if there's anybody out there that actually has experienced any of these pitfalls. Has anybody out there had any of these things happen? And I'm wondering if anyone wants to share how you got out of that situation. Because we know these don't work, or if they work, it's for a short period of time. Was there something that happened for you that was a switch? Is anybody?
Okay, but okay, don't have to yell at everybody now, thank you. But the proceeding as if nothing has changed, in my mind, if we sacrificed our lifestyle, that was the cancer winning, which is kind of twisted when you think about it, but I was just like, no, nothing's gonna hold us back. But we were frustrated and not enjoying life, and so once we were able to adjust to the new normal, which is a common phrase you'll hear, but it's a real thing, we were able to accommodate the needs of my husband being a brain cancer patient, and then we're able to enjoy our life a little more fully. So I don't know, there wasn't like a day that I woke up and it switched. It was just more, we were building frustration unnecessarily, and then we just found ways to accommodate.
Okay, thank you.
Oh, and the trying to do it all. Sorry, I did that one also. I was like, no, I've got it. I don't need anyone's help. But the minute you start letting in people and realizing they want to help and they don't know how to support, so if you give them things to do to help, then everyone feels like they're doing their part. So the trying to do it all doesn't help you, and allowing others to help makes them feel included and makes them feel like they're contributing to helping you guys. So let people help.
Yeah, thank you.
Yeah.
Thank you for that. I think one of the things we talked about earlier was just, again, allowing yourself to sort of give some space and time just to think about and acknowledge what happened. And in doing that, you start to begin to think about what you need and where you're at. And it helps you know how to proceed. It kind of goes back to what you were just saying. As the result of this illness, old ways of living and doing things together may need to give way to new. And I think that's the key. That's the new normal. And yet it's one of the hardest things to accept. I think we all go in kind of kicking and screaming around that. It's a huge challenge to accept what is, especially when we don't like it. When we don't like it, we want to resist. Some of us can do this on our own. Some of us do it with good friends. Some of us find benefit from talking with a therapist, our own therapist, or maybe a support group or a peer, someone else who's a peer mentor who's been there before. So we talked about some of the pitfalls. I want to talk about some of the things that we know work. And again, some of this you've heard already. We heard it yesterday. We heard some of it today. What I liked is that the caregivers were giving voice to me, the nurse, trying to share this. But I think these things work. And so I want to talk about that. So the truth is, adapting to this is a little bit like this goldfish over here who had to grow legs to survive outside of the fishbowl. Adjustments are probably needed, and most caregivers benefit from support. So again, it's allowing yourself to accept support. What support means is different for every person. It might mean rides, getting the kids to sports. It might mean help with meals, getting someone to medical appointments. Or it might be really finding someone who can help you through the emotional ups and downs of this, a place to really share your feelings and talk it through. So let's talk about what kind of resources are out there and how you access them. I think the most important thing I always tell people is start local. Start where you live. Start at your medical center. We're all from different places. What's available at your medical center? Some of you are at small centers, some are at bigger. Do you have any caregiver support services? Some people have a cancer center they can access. Sometimes there's actually services for geriatric patients that have some caregiver support. So kind of check out what's available at your medical center. Another great resource is your social worker. So almost every medical center has a social worker in the hospital. If you're lucky, you have one in the outpatient center. And another nice place to check is if anybody's getting home health services, home health PT, home health nurse, there's often a home health social worker. Check in and make an appointment with a social worker. Not only can they provide kind of a therapeutic listening ear, but they know what's out there for you. They can help you connect. Things that you might find that they might connect you with would be a caregiver support group, or maybe there's some nice one-day educational offerings out there for caregivers. Beyond your medical center, you all live in a community, in a city, in a town, so you can look outside of your medical center to see if there's anything else. Where I live, there's several brain tumor centers. So if there wasn't something at my center, I could look at the other center just 40 minutes down the road and see what they have available. Sometimes they have services for communities. So check out what's going on in your community, other medical centers and community agencies. And one that I want to highlight is that Family Caregiver Alliance. That's a national organization, but it has a link to every state in the country, and often within the states, the counties that provide caregiver resources. And I looked last night just to see what's on for Illinois, and there's actually an Illinois Caregiver Resource Center. So that's a great resource. Beyond your local community are some national resources. There are some disease-specific advocacy organizations, and I have to give a big shout out for the ABTA that has us all here. But they have great resources for caregivers. They have tumor information, treatment information, webinars. They have a wonderful resource of all the support groups around the country. And I feel like and they have a peer mentoring program. So they have something called Community Connect. So if you're a caregiver and maybe you're not finding the things that you want, you can reach out to the ABTA and ask to be matched to a trained caregiver mentor, another caregiver. I'm going to just call out National Brain Tumor Society. There's the Brain Tumor Network, which serves as a navigation group out of the Southeast. There's Brains for a Cure. And then I have 2 international organizations, the IBTA and Brain Tumor Charity. All of those are brain tumor specific, as is the Alma-Cella Foundation. And you can find tumor information and caregiver resources. If we just switch to caregiver resources, so take brain tumor out of the question, that Family Caregiver Alliance is an organization that's dedicated to support caregivers with neurologic illness. Anybody with a brain tumor falls into that that demographic. And then I also put in here cancer caregivers. So if you have a brain tumor that is cancer, you can access some of the resources from the American Cancer Society and cancer care. So all of these places have great websites that are worth checking out and getting on their mailing lists to care about their programming. Yes?
Sorry, I just wanted to add one thing because you were talking about the resources and your social worker or talking to your medical team. So that was really important for us because they could see that I was getting burnt out and they could tell that, they try to like treat the unit, if you will. And so in talking to the social worker, you're going to find out resources that you didn't even know existed. You also mentioned therapy. Through our social worker, she recommended a therapist that works strictly with families facing a cancer diagnosis and couples facing a cancer diagnosis, which sounds really niche, but it was so perfect for what we needed and you wouldn't even have known that existed. So I just want to reiterate that your social workers and your medical team, they have even more access to resources or knowledge of resources that you may not even know exist. So it's really important to make sure that you talk to them about you as the caregiver and your abilities to care for your patient. So, because they're trying to treat you both.
Thank you. Okay. Did I miss any? Are there any resources that people want me to shout out?
ABTA has a chat group on Inspire.
For caregivers?
For everyone.
Everyone. So ABTA has
ABTA sponsors that chat group.
On Inspire. I haven't heard about that. Is that available? Can you find that on their website?
Yes. It's
Yes.
under the Care Connection.
It's under the Care Connections? Yeah. Okay. Thanks for highlighting that. One more. Yeah.
Can I share? I have a table on the outside.
Yeah. Yes.
I'm a care consultant, and I, along with a partner, created a program for family caregivers. It's called Space and Grace. It's a virtual, free support program for family caregivers. It's 6 weeks. We were funded by the RRF Foundation for Aging. So not only is it free, but we really stress the importance of taking care of yourself. So self-care is a big part. At the end of the 6 weeks, everybody who participates gets a $200 stipend because we try to promote the importance of self-care. I have more information at my table outside. So just to let you know, the program is called Space and Grace.
Thank you for sharing that. Space and Grace. Is that, if we Googled that too, for all the people that are watching?
And we have even reached Canada. Word of mouth got out. So, and for people that live in the Chicagoland area, because of the digital divide, we wrote it in our grant so that anybody who doesn't have a computer, because this is all virtual, we provide one if they need one. So again, it's to empower the family caregivers and to make sure they have the tools they need to navigate this journey, new coping strategies, and tools to build resilience and practical skills for caregiving.
Sounds perfect. Great. Thank you for sharing that. So I wonder if any of you have heard of this quote from Viktor Frankl's book, Man's Search for Meaning. I think it's a great one for caregivers just to reflect on a little bit. And it goes like this. Between stimulus and response, there's a space. In that space is our power to choose our response. And in our response lies our growth and our freedom. So I don't think any of you had a choice about the tumor. but as caregivers, you do get to respond and choose how you care, how you take care of yourself, and how you interact with the world. Okay? So I think with that in mind, it's important to remember that this is a marathon. It's not a sprint. That sometimes sticking with old ways can drag you down. I want to invite you to experiment with new ways, to try things in a new way with your partner and your family and the way you do things. And I also want to encourage all of you and just remind you that you can all do this. You can do it. I know it's hard, but I think you can do it. So let's just talk about some of the ways to do that, okay? Number one was just remembering to access the resources. So start there. And if you feel too overwhelmed to do it, delegate somebody else to find out what's out there for you. Top priority, we'll go back to that emotional health. If that's weak, that's the main thing that everything else stands on, okay? So you have to ask yourself if you are feeling like you need help. I almost recommend that people check in with a therapist just to have someone to talk to, whether you think it or you need it or not, and they'll help you decide how much more attention you need going on. Your primary care doctor can make that kind of a referral. Okay, we know that a simple practice of gratitude, just once a day, thinking about 3 things that you're grateful for, can help mitigate feelings of depression. So that's something great. You might need to manage your emotions with self-talk. Pat yourself on the back. You're going to have to prop yourself up sometimes. And then this last piece, which is going to be a theme in every single one of these pillars that I'm going to talk about, is finding ways to relax. You need to find a way to kind of turn off sometimes. And that's going to be different for everybody. It might be a formal practice, something like mindfulness-based stress reduction or yoga, maybe an app like Headspace or Calm, but it could be exercise, music, whatever works for you. It could even be that breathing practice that we did at the beginning. Okay? We have to take care of our physical selves. So I always say, check in with the doctor, let him know that you're caregiving, keep up with your exercise best that you can. It could even be small bits of exercise throughout the day. Of course, try to eat healthy as you can. And sleep is critical to your success as a caregiver. I want to encourage you to nourish your social self. So often, again, as caregiving, we dive right in. We give up everything, and that can be hard to maintain for a long time and actually can cause burnout. So it's important to try to look for small ways to maintain who you were before the tumor started, right? For some people, it's trying to keep working. People find benefits. Sometimes they want to keep working because that was part of their identity. Other times it might be just getting out to exercise, go to the PTA meeting, maybe to the movies. This slide says do something once a week. I bet all of you would say that might be a big ask at some times. So even if it's just once a month, but trying to do something for yourself now and again. We heard a little bit about focusing on the relationship with the patient. I liked what you talked about, the beekeeping. So trying to find something with your partner that you did before the tumor that's not about going to the doctor, not about medicine, but really something beautiful that you can continue to nurture your relationship. And then look here, stress reduction goes with this one too. And then lastly, nourishing your spiritual self. And this is really about remembering that you are not alone. We're all part of common humanity and we're connected. And the way people do this is a little bit different. Some people do it through a faith community. They find great strength. Some people find it with connection with other caregivers, and some people find it just by making time to reflect and process and write down their feelings. In spite of all these things, brain tumors make it hard for caregivers to stay balanced, and it's so easy to kind of end up on this distress side, okay? What I want to invite people to do is just to think about there are some things about caregiving that are fulfilling. And I'm guessing some of you might be like, are you crazy, Margaretta? What's about that? But if you allow yourself to think about it, some people do find that they have a stronger relationship with their loved one with the tumor. They actually find a sense of purpose in their caregiving. Some people figure out ways to live out their values. So they really take a minute to reflect on what do I value? And so it might be things, for example, but it could be love, commitment, responsibility. Those are values that you can live out through your caregiving. And so again, gives you a sense of purpose and accomplishment. So all of you are doing amazing things, and it's important to take a moment to recognize your accomplishments. Okay, one time I heard our minds are like Velcro for all the negative things and Teflon for the positive things. So we always hang on to the negative things. So you have to make an effort to acknowledge the good things that you're doing. I had a caregiver once tell me, along with his gratitude practice, he would acknowledge his tiny victories every day. And it could be small things, but again, making sure that you're noticing what you're doing well. So the positive aspects of caring are meaning and purpose, accomplishment, noticing those positive relationships, those other angels we heard about yesterday that come through. Again, paying attention to the positive and cultivating self-compassion. How many of you have heard about that? There's a lot of work on how important this is for caregivers. It kind of goes along with that that thought about being negative and hard on ourselves. We tend to be judgmental in a negative way. We're hard on ourselves. So the goal for that is to treat yourself as you would treat a friend. Let yourself talk to yourself like you would treat a friend in the same situation. Remember that you're with others, common others, okay? And mindfulness also can help with cultivating compassion. We heard a little bit about resilience. Resilience is also an important thing to try to foster along the way. It's not an extraordinary trait. Actually, we all have capacity for it. It's like a muscle. It won't take away the hard things, but it does give you the strength to sort of get through, and for some people thrive in spite of the hardship that they're going through. And a few steps that kind of go along with the things that we're talking about are the gratitude practice, taking time to reflect, giving yourself some space just to think about things, connection, whether it's connection with your friends, whether it's connection with a peer group. Caregiver support groups are great for this. And then leaning into what matters most. So really letting yourself think about what your priorities are and how you're going to live your life. Okay? So we're getting close to the end of my section. I actually think those of you who are in this room that are living this and walking this journey are probably the greatest resource for each other. We've talked about a few things. I'm going to ask you some questions. I'm going to give you a chance to just think about some answers, and then maybe we can share as we wrap things up. Does that sound okay? So the first question is, what of any of these self-care strategies that we talked about, that's what those were, self-care strategies, are you doing right now? Are any of you practicing some of those now? So I want you just to take a minute and acknowledge that. What are you proud of when you think about what you're doing as a caregiver? What are you proud of? Are you delegating? Are you making time to get out and exercise? Are you living out a value? Is there anything you're proud of? If you were a friend, if you were your friend, what would you say to you? What would you say to you? What words of encouragement or advice? What would you say? Have any of you noticed a newer, stronger relationship? Somebody that showed up that was unexpected? And then finally, after today, maybe something that you saw, was there anything that you might put into your toolbox and do differently or think about differently when you leave here today? And if you did, what's a step that you might use to accomplish that? So when we close our caregiver support group in San Francisco, one of the things we always talk about is the collective energy that the community of caregivers has. And so sharing amongst each other is so important. So I would like to I'm going to go through those questions again, and if one or two of you want to pop up and share your answers, that'll be nice for the others to hear, and I'd like to do that. So would anybody like to just talk about a self-care strategy that they're using right now? Something they're already doing for themselves? Yes. Here comes the mic. I'm going to let the mic come your way.
I like doing meditations. I forgot what they're called. I just do it on SoundCloud. It's like a body scan meditation. It helps me sleep. And also, I like doing artistic things, so I treat myself to an art class once a week.
Okay, so did you hear that? So meditation, do you do that at night, a meditation?
Yes, it helps me sleep.
And art. And are those things that you started after you became a caregiver, or?
No, I've been doing them for a long time, off and on, but I'm a little more diligent now.
Okay,
Yeah.
great. Anybody else want to share a strategy that they're using? I got one, and then you go.
Hi, I'm a musician. I play ukulele with my friends, and I find after my husband goes to bed at 9 o'clock, after I put him to bed, my time is the 2 hours after, and I just lose myself in the music. And that way it's my time, and I'm grateful that my friends get to pull me out, and once in a while we get to play out in public. And we did that a couple weeks ago for Plays Music on the Porch Day, the last Saturday of August, out in public. So I'm grateful that I'm grateful that my husband is well enough that I can leave him alone. Especially, he just had a resection 5 weeks ago, glioblastoma, grade 4. So I can leave him at home alone, that I can go do this, and I know that he's safe and stuff. So I can go out and play music and just lose myself for a while before I have to come back and be a caregiver and, a medical. I hate to be a medical expert on this crap.
Yeah. So
Thank you. Excuse my language.
Thank you for that. So what I heard you say was really connecting back to both of you, actually, things that were important to you before the illness, your music, your art, and then I heard gratitude too. So again, just remembering to be grateful. One more, and then I'm going to move on to another question.
Oh, I have lunch with my dearest friend once a week, which is a new practice. We just did it when it fit in before, but I find that really important. And then I have the Calm app that I got a subscription for that's been really helpful, similar to what Robin had said with body scan things.
Wonderful. So did you hear that? The Calm app and lunch with a friend once a week. Committed to making time for that for yourself. Really great. Is there anybody want to step out and tell us something that you're proud about that you're doing as a caregiver? That you are like, wow, I'm doing this. Anybody? Yes.
I found out about this conference from a really longtime close friend of mine who was diagnosed as a young person with the glioma, but then she really came in to support when my mom was diagnosed with also a grade 4 glioblastoma, and she told us about this conference. So I feel like just being able to connect myself and my mother with this is also, while we are like focusing on this topic, it is also breaking us away from just being in appointments and like platelet transfusions, all of the like stressful like roller coaster stuff that's going on, and finding ways to be, connected with like looking ahead and research. So I'm glad that, thanks to my friend, but I'm glad that we were both able to kind of motivate my mother to also come here as well.
Yeah. Thank you. So you tried something new. I like that too. Okay. So in the next one, then how about if you were talking to your friend? If you were a friend talking to you, anybody want to share what they would say to their friend who happens to be themselves? I know it's kind of personal. You got one? Okay.
I can tell myself that I'm really proud of the fact that I've got him 16 months now into this, and I'm smart enough to understand the medical terminology, that I'm not a deer in the headlights anymore when a medical professional talks to me, and I can bring back. Basically, we live in a small rural community. We have one stoplight in the county. So unfortunately, I don't have 3 brain tumor, resources around. So our oncologists have basically tasked me to come back with information and stuff. My husband uses the Optune, so it's like, okay, you go and find out from Optune today, when to come back and stuff like that. And I'm coming back with the trials and stuff like that. So now that he's going to restart his new treatment after his his first resection, what kind of trials that we can do and put him on. So I'm becoming the medical expert to help bring back that, and I'm really proud that I can do that. And again, I'm grateful. I'm so grateful that I have the intelligence to do that. And I'm so grateful that I see you guys. I see all you guys that are caretakers doing the same thing.
Mm-hmm.
I see you guys.
Yeah.
So I'm grateful you guys are doing it the same too. So I'm
Thank
grateful
you.
you're here for them.
Thank you. Thank you. I'm going to bring the microphone up here, and I'm going to switch. This is the last thing we're going to do today. I want all of you to think about your superpower. I bet you all have one. No matter if you're a caregiver, a patient, a provider. I want to know what your superpower is. And if we could just go around the room, this is the last thing we're going to do, then I'm going to open it up for questions. But if you could just pass that mic, and we're just going to say what our superpowers are as we finish up today. Okay? So we'll start.
I'm going to start. I'm a former caregiver, and I would say perseverance.
Perseverance?
Perseverance.
Wonderful.
I was a pre-med student, so I had medical knowledge before starting being a caregiver, and retaining a lot of that information definitely helped us out.
Medical knowledge. I'm just going to repeat them all so you can hear them.
I guess just connector, connecting resources, relationships, friendships.
Connector.
Say I have an even temperament.
Even temperament.
I'm just going to say just doing what I need to do. People say, how do you do it? You just do what you need to do.
Do what you need to do. Yeah.
Just trying to stay calm.
Stay calm. Yeah.
I guess my tag says troublemaker. That's, I'm required by law to have this on. So I'm the troublemaker that makes sure that things get done for my husband and
Great.
myself.
Thank you.
I'm going to say encourager or motivator. My wife basically got kicked out of the rehab hospital because they didn't know what to do with her. And, she'll tell you that. And what I constantly heard was, you can't do, you can't do, you can't do. And when we got home, I looked at her and I said, I'm not going to sue myself. Do whatever you want to do. And I saw almost an immediate. She was constantly being told no, and I told her to go for it,
Okay.
and it helped.
Motivator, encourager. I'm going to invite us to go one word at a time, though, because we're going to run out of time. So I want to make sure I hear from everybody.
For me, it's being a listener.
A listener.
For my wife, but also for me.
Yes.
I would say being resilient and resourceful.
Wonderful. Resilience and resourceful.
I'm intuitive. I have my eyes on my husband, and I know what he needs.
Intuitive.
I think I would go with resourceful as well.
Optimist.
Optimist. Resourceful.
Strength.
Strength. What did you say?
Strength.
Strength.
Logical.
Logical. We have a wide variety of superpowers, don't we? Together.
I would say grace, because this is a very hard process, and just giving ourselves grace and the loved ones, like my dad struggling with my mom right now, just accepting all this, and he hasn't been the nicest person, and it's just a lot in everyone. So just knowing that we're doing the best we can and educating ourselves, and then giving ourselves grace for what we're going through and entering this whole new world that, you know, that we're all trying to deal with.
Yeah, thank you. Grace.
I'd say acceptance.
Acceptance.
Understanding what's happening and getting through it.
Resiliency.
Resiliency.
My superpower as a caregiver was that I was super organized and planned really well.
Organization and planning.
Ability to prioritize, to know what the next best thing to do was.
Ability to prioritize.
I think researcher, and also being able to be pushy for getting my husband in and who I wanted him to be with. And I would just implore people to don't take no for an answer. You can get in with the neuro-oncologist you want to. You just have to be a bulldog about it. And I think I've been really good at that. And he's 4.5 years out on glioblastoma multiforme.
Wonderful. So researcher, and I think I like the word assertive. Assertive. Yeah.
Yeah. I would say supporter and advocate.
Supporter and advocate.
My superpower is compartmentalizing.
Compartmentalizing.
Or, I mean, at least I'm trying to have that be my superpower.
Yeah.
Showing empathy and being a good listener.
Good listening and showing empathy.
I think mine is also calm.
Calm.
You stole mine. Calmness.
Must be genetic. Calmness.
I think mine is being knowledgeable and compassionate.
Being knowledgeable and compassionate.
My superpower is my faith.
Faith.
Making peace with things I can't control.
Making peace with things I can't control. Wow. You all are superheroes, caregiver superheroes. And as a healthcare provider, we couldn't do the job we do without you. And I just want to acknowledge that, and I want to thank you for that, and thank you for being here. And that's all I have to say. So I'll open it up to questions if anybody has any. Any questions?
Actually, my husband actually is a patient of Dr. DeGroote's.
Oh.
And right in your neck of the woods. But we live here in Chicago.
Huh.
Is your caregiver support, I get emails, is that a virtual?
It is.
Okay.
We should talk.
Okay.
You're allowed to come.
Okay.
Yeah. I did get an online question through the Hoover app, and it was about online support for people that live where there aren't resources or their centers don't offer resources. And so I wanted to just mention the ABTA. We know about Community Connect, and we heard about the chat, the Inspire chat. Brains for a Cure, which is another patient advocacy organization, I think out of Oklahoma, or has a Caregivers Conversations, which is a Zoom chat that happens once a month, open to everyone. National Brain Tumor Society has some things also for patients and caregivers, nothing caregiver specific. The Family Caregiver Alliance is a great resource. Cancer Care has like an email support group. And then I did look up the Illinois Family Caregiver Support Program. They may have some resources for those of you that are from Illinois. Oh, sorry, yes. Wait, we're going to have you get a mic. Yeah.
I work at the University of Southern California Brain Tumor Center, and we also offer a virtual support group. We do have a booth if anyone wants to stop by and take a picture of our QR code or get an email. But what I really wanted to share, not pushing my group, was that during one of the sessions of the support group, I thought was just an amazing thing to share, and it reminded me yesterday when we were talking a little bit about being angry, you know, where do you put your anger? One of the caregivers mentioned that she and her partner named the tumors. And so it's an opportunity to be angry at these, whatever names you give them, and the names that I remember were Benny and the Jets, you know. So it's, you know, maybe it's a bully from grammar school that you want to, you know, take that aggression out on, but just to have somewhere to direct that anger.
Yeah. Can I ask you is that a patient and caregiver group, or is it a caregiver group?
Caregiver.
It's a caregiver support group that's
yes.
open?
It's virtual, so
Wow.
it's open. Yeah.
Wonderful.
Yeah.
Thank you for sharing that.
Sure.
Okay. If there are no more questions, then on to lunch. And enjoy the rest of the day.